Welcome to the media advisory for this Friday, the final advisory of this week, and welcome to CHML and the media that are dialing in, as well as citizens that are down.
The Hamilton Bulldogs season has concluded, but you can revisit every game with our daily flashback show, Bulldogs Breakfast. Join us every morning as we play back all 62 regular season games, reliving all the highs, lows, and milestones from the previous season, including the emergence of rookie sensation Jan Mysak, as well as star forward Arthur Kaliev becoming the Bulldogs' all-time scoring leader. Be sure to set your alarm or your DVR and tune into the Bulldogs Breakfast every day at 9 a.m. on Cable 14, your home of the Hamilton Bulldogs.
During this difficult time, many families are struggling with food insecurity. Food for Kids is responding to children and families impacted by COVID-19. Grocery gift cards are being mailed, and where a family can't visit a grocery store, we are delivering food to homes. Food for Kids is committed to ensuring no child in our community goes hungry.
We've provided help and assistance through emergency shelters here in Hamilton at the First Ontario Centre, as well as at hotel locations for women, drive-through testing sites in our arenas, free HSR transit, educating and encouraging people to physically distance and including property tax deferrals as well. So we've seen a decline in revenues and increase in expenses. And we're certainly appealing to our federal and provincial partners that there's a need for some sort of assistance for municipalities going forward. So I think the economic recovery that we all anticipate would certainly be helped by that, as well as looking at economic stimulus thereafter to help support getting people back to work and supporting our local economy. So we continue to work with our federal and provincial partners on all of those matters on an ongoing basis. As well, today, the federal government announced the Canada Emergency Commercial Rent Assistance. This will lower rent by 75% for small businesses that have been affected by COVID-19. The program will provide forgivable loans to qualifying commercial property owners to covers 50% of 3 monthly rent payments that are payable and eligible for April, May, and June. So the impacted small business tenants are businesses paying less than $50,000 per month in rent and who have temporarily ceased operations or have experienced at least a 70% drop in pre-COVID revenues. This support will also be available for nonprofit and charitable organizations. So very helpful assistance indeed. The province partnered with the federal government on a rent relief program, and it's committing to $240 million through the Ontario Canada Emergency Commercial Rent Assistance Program. The total amount of that provincial federal relief will be in the aggregate amount of $900 million across the country. The province also launched an action plan to assist vulnerable populations during this outbreak. They plan protects people living in high-risk settings, including homes serving those with development disabilities, shelters for survivors of gender-based violence and human trafficking, and children's residential settings. As well, they laid out a set of interventions to enable prevention and infection control while maintaining service continuity for the benefit of vulnerable clients and staff. A lot of this information is on our website, including the financial supports that I talked about a little while ago. Go to hamilton.ca/coronavirus/financial support individuals. All of the available announcements that have been made and direct links to how you can apply for all of these supports are on that site. As well, City Council dealt with a request to close James Street North and sought the advice of the Emergency Operations Center through Public Health. And I know Paul Johnson will be addressing that a little later on. Modified delivery of some services. So many services have continued throughout the pandemic, including essential services, support services to those that need services and access to public services online. There are some services that we can restart on a modified basis in a way that ensures we continue to adhere to the provincial orders and that the health and safety of our staff and the community. So we will be implementing physical distancing practices, staggering hours, and increasing cleaning practices in some of these areas. So restarting these modified services will require redeployment of some staff And those services being restarted are critical to maintaining our facilities as the seasons change. So, one of those changes is going to be at the Gage Park Production Greenhouse. Beginning this week, a small number of staff will be returning to work at the Gage Park Production Greenhouse. At this time of year, horticultural staff will be tending to juvenile plants that will be used in the flower islands and other gardens throughout the city over the course of the summer and late fall. Preparations of the garden beds is intended to start May the 4th, 2020, and planting of the beds is scheduled in late May. So, as well, the Mum Show, which requires a significant amount of planting in order to have that material available for the Mum Show later in the year. Staff must take cuttings and propagate those plant materials in mid-April, as of like right now. So the horticultural staff are being deployed for the next 3 weeks to complete these tasks, and uh, beyond that 3 weeks, on-site staff will be required, but very much less so going forward. So those additional staff will be redeployed as well. The bylaw enforcement continues, and they're at capacity as in terms of full deployment. The COVID-19 related calls are prioritized, so they're focusing on ongoing enforcement of facility closures, waterfalls, parks, dog parks, etc., provincial orders, as well as the city's physical distancing bylaw. The enforcement also continues in the response to the related other city bylaws that represent health and safety concerns, and that includes vital services, vacant buildings, emergency property standard matters, and illegal cutting of trees. And there will be a staff redeployment there as well for the COVID-19 related calls, particularly in the Property Standards Division, which will bring the level of enforcement for COVID-19 calls up to a standard more in line with the pre-pandemic service levels. We'll continue to support our vulnerable residents, and the operations leads and the health and safety community department staff have been working hard to ensure most of our vulnerable residents are supported at this time. Staff are supporting the emergency shelter system, including the opening of the isolation center at Beneto and the men's shelter at First Ontario Center, and continue to provide support for women and families in the shelters staying in hotels, continuing to provide assistance in food and permanent housing as needed during this crisis and potentially into the future. Some good news stories coming out of the last couple of weeks. A shout out to the Hamilton Burlington SPCA. They're offering free compassionate boarding services to people affected by COVID-19 and have no one else to look after their pets. Program is called No Pet Left Behind. Visit the hbspca.com site to learn more about this program. And a thanks goes out to Marion Emo, the CEO of the SPCA, and everyone on the SPCA team. We know that many in our community working on the front lines have pets and may not be able to give them the attention they deserve. So free boarding is offered to you to help your pets be well looked after during your very important work. Also, a shout out to the Art Gallery of Hamilton. Their annual art sale, originally scheduled for April the 23rd, was canceled due to the COVID-19 pandemic. The art sale will now go virtual and will be reimagined as an online presentation. The 2020 art sale online will be hosted on their website at the aghartsales.com. So the Art Gallery of Hamilton, artsales.com. Congratulations to Shelley Falconer and the AGH team for this innovative approach. And lastly, a shout out to the Bob Kemp Hospice. They're responding to the need for social distancing by hosting a virtual hike, walk, or run fundraising event. This is a fundraising that our hospices are required to do to maintain the services that they provide in terms of palliative care, and that work continues. And so this fundraising opportunity is very important for the Bob Kemp Hospice. So far, 63 people have registered online for the fundraiser, with 20 people participating offline. About $20,000 has already been raised, so thank you to all of those that have contributed. Go to their website, kemphospice.org, to learn more on how you can take part. Participation began on April the 1st, but will continue until Saturday, June the 13th. So a special thanks goes out to Claire Freeman, the executive director at the Bob Kemp Hospice, and their entire team that continues to provide very important palliative services in our community. Thank you for all your good work. And if you have a chance, dial into the fundraiser. I think it's a great opportunity to support a very, very good organization. I'm going to turn it over now to our EOC manager, Paul Johnson, for some EOC updates. Paul?
Thanks very much, Mr. Mayor. And I'll start with just picking up on a piece that you mentioned in your opening remarks, and that the EOC was asked to look at one thing in particular, and has also been receiving a lot of questions about another topic. The first that was referred to us specifically was around the closure of James Street North. And we did look at that, and in particular touch base with Dr. Richardson and public health. At this time, there are not volumes of people in our community using sidewalks and pedestrian ways that would require us to close streets. And to be honest with you, the message remains the same. Stay at home, stay close to home, and only travel for essential daily activities. So for those reasons, there are operational reasons that were also there, but really the key pieces for us were around those where we are in this pandemic, where we are in terms of some of the restrictions that are in place and our messaging. We're not going to be pursuing a road closure at this time there or in any other place, to be honest. And I think some of these ideas, there may be a time where we have some of these discussions as some of the restrictions start to be relaxed in this province and in this city. But at this time, the main messaging for folks is do your part to continue to keep the number of spread of this cases as low as possible, and that means staying at home and recreating really in your home and right around your home, and not looking at areas where people would congregate. It might actually have a negative effect by opening up just a few areas where people can congregate. Lots of comments and questions about community gardens. They continue to be under the closure order of the province of Ontario. Now until May 6th. If that changes at any time, we would obviously look at that and how to do those activities safely, but the EOC is not pursuing any activity as that's covered explicitly under the orders. And the last thing I'll say before turning it over to Dr. Richardson for our update in terms of where we are from a case perspective is, as the mayor mentioned, starting some modified services that weren't there last week or the week before. We've talked about yard and leaf pickup that did start this week. All of these decisions take a lot of time because we take very seriously the fact that really non-essential work should not be happening. And so our decision making in some of these services is not that we just get back to work as the city. It really is about what are those things that are critical to maintaining the infrastructure and the assets of the city, and also providing some safety to folks in our community. And so some of the grass cutting that's taking place is for that. If our parks become overgrown and completely out of control, that actually has an impact on people's ability to use one of the few things that they can still walk through and enjoy in this community. But you will see that these, in all cases, are modified levels of service. And so they won't be the same type of cutting, and it may not be as nice looking at the end of the day as you would normally expect in our parks. We're going to do what's minimally required in order to keep these assets going, but really respect the fact that we have a lot of people redeployed to other key areas. And also, we're not interested at this particular moment in bringing more people back out of their homes and to work than we absolutely need to. So that's the thinking around it. It isn't as simple as just saying, yep, let's get going. Yep, the weather's getting better. We do have a lot of those conversations around our EOC table about what our role as leaders is in this community in terms of how we should be all handling ourselves, particularly in this piece of time where we are certainly starting to look towards recovery and de-escalation of this, but we're not there yet. And we're doing our part to reinforce that message that it is continue to be stay at home and only go out when you really need to, and help each other out so that others can stay in their home as well. Dr. Richardson?
Thanks, Paul. That's a great message to have out there, that we're still very much in the midst of this. And I think as we go through the updates today, you'll see that we are and that we do need to be, thinking about the longer term and what this particular virus means for all of us, because we are going to have it with us for some time to come yet. And I can tell you that's what many people are thinking about. But staying the course, as Paul and the mayor have said, is very important right now. So in terms of the number of cases today, we have 369 cases as of noon today, 364 of those lab confirmed, 5 are probable. And of course, there's a lot more information on our website around the cases, demographic information, risk factors, those sorts of things. We have rearranged that information a little bit, and so please familiarize yourself with it. It's all still there, but we're trying to make it as well laid out as possible. And also, we have included now those outbreak numbers on there and some more details about them as well. So we're trying to give as much information as we can through that route. And we do have, of those 369 cases, 186 of them have been resolved, so almost 50%. And that is very much encouraging, or sorry, just over 50%. So that's very much encouraging as we carry forward. There haven't been any new deaths, thankfully, from COVID-19. We do have 5 confirmed institutional outbreaks and 3 confirmed community outbreaks at this point. The newest outbreak today is at the St. Joseph's Healthcare Hamilton West 5th site, where 2 healthcare workers tested positive in one of the inpatient units at that campus. They are both now self-isolating at home, and St. Joe's is undertaking a number of measures to ensure the greatest safety to patients and healthcare workers. They are monitoring closely all of the patients and identifying those who further need testing. Families of those who are at that site are being informed. Contact tracing has been initiated for all of the healthcare workers, which identifies those requiring further self-isolation, self-monitoring, and these nasal pharyngeal swabs that are used to test for COVID-19. In addition to thorough daily cleaning, which they of course already do all the time consistently, they will go through a deep cleaning of the unit now that this has been found, and then continue on with using all of the infection control measures that are recommended in this situation. As I mentioned, we did start posting more details about our outbreaks on our website. And as I said, that is updated each day at noon. I do want to tell you that we do have 4 emerging outbreaks this afternoon that you're going to hear about more over the weekend. So we have heard, and we're still investigating each of these ones. So I don't have any further details than what I'm going to share with you right now, because this is literally hot news, and the website will not be updated until tomorrow with the further details, because they'll be collected over the day to day as staff work with these institutions. So the first is at Hamilton Wentworth Detention Center, where 1 inmate has been confirmed. The second is at St. Joseph's Villa, and then 2 further outbreaks within the Charlton campus of St. Joe's Healthcare Hamilton. So those are all underway in terms of investigation. They'll be confirmed and further details provided noon tomorrow when we have those. In terms of other updates, I just do want to continue to say thank you to all of those that are working so hard in this response. And as you can see, as we carry forward with all of the testing that we're going to be doing over the coming days in our long-term care homes, we may well find additional positives in those settings, because we do know that there are some people who are either asymptomatic with this entirely, or maybe pre-symptomatic. And so it's not unanticipated that as we go through that process, that we may indeed find some additional outbreaks. And so we are there to support each of these institutions as they go through that process. There is a team, as we've talked about before, that is assessing these sites, working with these sites, and helping them in terms of whatever it may be that they need. And there's a lot of very good work that has gone on across all those sites. So certainly if we find additional positives as we go forward with this work, it's not a surprise. It shouldn't be taken as any of those sites not doing the best job that they can in terms of infection control and looking after the people who are in those sites. So I just wanted to reemphasize that and all the very good work that is going on to support people. Thanks very much.
Thank you, Doctor. Thank you, Paul, for your ongoing good work. And we also thank Rosalie Visers and Georgia Whalen, who are doing our American Sign Language interpretation. Thank you for that effort. And of course, as the doctor just said, everybody that's out there keeping our city functional, paramedics, healthcare workers, police officers, grocery store workers and pharmacists, on the front lines, manning the stores to ensure people get the food they need and the medications that they require, and the truck drivers that are delivering that right across the country to make sure the supply chain keeps working. And of course, all the additional work that's being done by cleaning staff in all of our facilities, whether it's buses or in various facilities that we own and operate, and make sure they're all clean and sterilized as much as possible to provide no opportunity for that virus to spread. And all of that work continues, and they're doing all of that work predominantly so that you can stay home as much as possible. So do it for them. They're putting themselves at risk every day. For them, we can all make the effort to stay home as they make the effort to make sure that we can conduct a reasonable standard of living and life as we go forward. So all of the information that we've mentioned previously is on our hamilton.ca/coronavirus website. So please dial into that. Yeah, for those that are looking to support local business, go to the investhamilton.ca website, or if you're looking to shop online still, a lot of some 300 plus companies or restaurants or facilities have joined the Hometown Hub. You can shop there if you're wanting to order out or order in, I should say. Lots of opportunities to do that through that location, and you can still support the local businesses that are trying to support themselves through this pandemic. Again, for those that are in crisis, mental health is obviously a particularly acute issue and can be even more acute now through this pandemic process. There is help for you. You can call the Coast hotline at 905-972-8338. There is help on the other end of the line for you, and for kids that are challenged right now that need someone to talk to, possibly in a awkward domestic situation or struggling with what's happening in our community and need someone to talk to. There is help for you as well. Call 1-800-668-6868. It's the Kids Help phone line that is available to you all the time, but is available to you now as well, and probably may be more helpful now than ever. So you can also text 686868 for those that would prefer to have a text conversation. You can also help by donating blood. Critical surgery still is happening, and blood is still very much required on an ongoing basis. So if you can, dial into the blood.ca website and identify a local blood donor clinic near you. And if you are able to, I think it'd be very welcome that you continue to provide plasma and blood services for those critical operations that are ongoing as we speak. All counselors and staff continue to work and are available to you at the regular email contacts and regular phone numbers. So don't be shy to get a hold of them, and any questions that you have that you need answers for, or any service issues that you want to get clarified, they can do that for you. So on our website, all of their contact emails and phone numbers are there. And lastly, we of course encourage and thank all the churches that are ringing their bells Wednesdays at 6 and Sundays at 6 to honor all the frontline workers that are working so hard to keep us safe and protected and fed in our community. So thank you for all the churches that are participating in this great effort. Today marks the 105th anniversary of the Armenian genocide. So I join our Armenian community in mourning the 1.5 million innocent souls that were lost 105 years ago. Together, let us remember and honor the victims, survivors, and heroes of that dark time. And for our Muslim community in Hamilton and around the globe, it's the beginning of Ramadan. So this year's celebrations will be a little different, not unlike Easter. We're requiring that people celebrate at home and do it online, or find some sort of virtual way to connect through this holiest of times. And we wish you Ramadan Mubarak, happy celebration and a month of fasting. And we thank all of the work that you're doing in our community to look after the hearts, minds, and souls of many in the Muslim community. Lastly, yesterday, an apology was delivered to by the Associate Medical Officer of Health to the Premier of Ontario. We respect the Premier and the job he is doing, and we're abiding by the Premier's call to test all residents and staff in long-term care homes. I think the Premier is quite right that testing is going to be a very critical part of how we continue to move forward on this longer term pandemic coronavirus issue. So testing for all 27 long-term care facilities will begin. May not happen in the course of a few days, but it will take place and will be ongoing. And obviously the need is great. And our medical officer of health has determined that it's appropriate under these circumstances to make that effort. And our associate medical officer of health has indicated that his comments suggesting that the Premier um, uh, wasn't a doctor and shouldn't be making comments on some of these issues. I think he's indicated they were inappropriate. He's apologized. It certainly doesn't reflect our view collectively as a community. And I do respect the fact that he has admitted his mistake and we're all prepared to move on. I think Dr. Harvey is a great medical officer of health, certainly a great doctor and a very compassionate individual that cares deeply about how our community advances through this issue. I appreciate his apology, and I'm sure the Premier does as well. And we wish the Premier's mother-in-law well, who was just recently identified as having COVID-19. And it's an indicator that none of us is immune from being affected by COVID-19, or directly or indirectly. And we continue to hear about those cases going forward in the media and otherwise. So thank you all for dialing in, and I'm going to turn it over to Jazz for any questions from the media, and then we'll deal with those. And thank you for tuning in.
Thank you, Mr. Mayor. We do have 5 media partners on the phone today. We'll start with Joanna from The Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. Today, the province said that it's going to be early next week providing its framework for how to start to slowly reopen the economy. Is the city planning to do the same thing? And do you have that framework? And when will you be releasing that?
So I can address that. We're just actually bringing a motion to council to begin the process of developing a terms of reference for a mayor's task force on recovery. So we're turning our minds to that. Staff have already been doing that, but I think we formally want to create a task force that would include some leadership in our broader community and the business community and otherwise, to start looking at what does recovery look like based on the public health recommendations that are coming forward. So we'll be bringing that to council on Wednesday, and then staff will be bringing a full terms of reference and a participation list of individuals in our community that are going to come together and start thinking about how do we go to recovery, how do we implement some of the recommendations that the Premier might put forward, how do we enhance the recovery efforts in Hamilton so that we can do as much as we can as quickly as we can, given the constraints that the virus might be giving us. So that will be coming to council on Wednesday to kickstart that process.
Thank you very much. And for Dr. Richardson, when it comes to the outbreak at the West 5th campus of St. Joe, is there any concern about overcrowding in that facility? Have you found overcrowding in that facility? Have you made any recommendations? Are there concerns around that there?
Thanks, Joanna. No, I'm not aware of anything at this point. That is certainly one of the things that staff will be looking at as they investigate it, is to make sure that physical distancing and all those measures that are so important, we know, in terms of outbreak management, are being followed, and even some heightened ones. We've talked about those in the past, where we recommend that they use then disposable dishes and all of those sorts of things to try and minimize the amount of contact and objects going back and forth. So we'll be looking at those issues. Haven't been raised with us yet, but it will be something we look at.
Thank you. The next question goes to Dale from CHCH. Dale, you can go ahead.
Hi, whoever wants to take the question, either Paul or the mayor. Is there any consideration to release people from the detention center to help the physical distancing now that we know that there's somebody that's tested positive?
So I don't
think
know of continued efforts to do that. I'll start things off. I do know that there were some releases earlier in this, but I don't know of any plans to further do that at this time.
Dr. Richardson, did you want to address that?
Sure. There's nothing that I'm aware at this point. As I said, we've just gotten this. This is hot off the press sort of information in terms of the receipt of this right now. We've been working with the detention center, over time to look at what the issues are and how can they, minimize any chance of spread that should a case be introduced there. And we'll continue to do that with them. But ultimately, the correctional issues and deciding on release is their responsibility and will be providing them with infection control and outbreak management advice.
Did you have a follow-up question, Dale?
Yeah, Dr. Richardson, can you just talk about the importance of antibody testing and where the city is at on that front?
Right. So this is something that's a hot topic all around the world as we're trying to understand COVID-19 better than we do right now. And so this, if for others, what Dale is getting at is the blood test that we're waiting for to be approved and utilized across the country. There's been some early versions that people are working with. And what this does is allow us to look at and do something called a seroprevalence survey. So what that means is they test the blood of a group of individuals. It's often done from blood samples that are already being collected for other reasons. And they look to see whether or not they've developed antibodies to COVID-19, which would mean presumably that they had been infected along the way and their body had developed a reaction to it. Often when they do these studies, they don't have other information about whether they've been sick with COVID-19 or not, but it does give us a sense of how many people may have been infected with the virus as we go. It's a very important piece of information for us to understand in terms of the degree of cases that are asymptomatic versus not, because we will still have a check against the number of cases we have reported, but it's also there to just give an idea of how much herd immunity is developing as we go forward. We know when we did testing of this sort after West Nile virus was first introduced in our region, that we found that there were many more infections than in fact we knew about. And we now know that for West Nile virus, only a small portion of people actually become symptomatic and an even smaller portion actually have serious symptoms. So that's the kind of work, that's the kind of thing that they're looking to do. And we keep saying, when are people going to be ready with this test? When can we start these coordinated seroprevalence surveys and looking at it from a research angle? And we're still waiting on that piece on a larger scale, but know that the planning is being done and that there are people around the world who've already begun that with some of the assays that are available.
Thank you. Next question goes to Don Mitchell from CHML. Don, you can go ahead.
Hi there. Right now there's a lot of talk, and I mean, Mayor Fred, you were on this morning with Bill Kelly. Thank you very much. And at the end of your interview, you talked a bit about, task force and potentially we're talking about down the road spaces being opened up and relaxation of rules and that sort of thing. And I know a lot of that comes from the province, but with a lot of talk, especially like in Saskatchewan and a few other places about potentially, starting to relax rules, businesses start to open up again and that sort of thing. And this may be a question for all three of you really is, what are the benchmarks that you guys see in your mind as things that need to happen in the city before we can even start thinking about that? Are there any like hot spots that need to be dealt with first, or what kind of benchmarks do you think we need to see in the city before we can even start going down this road?
I would say that Dr. Elizabeth needs to go first because the benchmarks that we're going to use are going to be driven by public health. So, Doctor, maybe you take the first shot.
Sure. Thanks, Mr. Mayor. So those are the questions we're all grappling with. And I know on the provincial and federal level, they're talking about those things as well. And what kind of benchmarks can we use? And there's various ones that have been proposed and used in other countries around the world. Things like, what is the rate of new cases that are happening? That is one piece of it. Some look at the number of deaths because they're an indicator of the severity of the disease that is happening. So those are sort of the main pieces related to it. Of course, we know we also need to look more broadly at what are the impacts that are being had, and what are the control measures that we have in place? What are the implications and the consequences from those particular control measures that are there? So it all has to be brought together and considered in terms of how we go forward and find the best path. So far, there hasn't been one right way of doing this that any country has found around the world. There's different strategies that they're using, and it's great because we get to be safely here in the conditions that we are, as safe as we can be with the full public health measures that we have in place, while other countries are starting to grapple with these issues, and we're going to continue to learn from them as we go forward. We're very fortunate to have a group of talented people who are coming together to look at just those things and learn from them.
I mean, from my perspective, I would say we're quite a ways away from that, and I know that many of the conversations are turning their minds to what does recovery look like and what does opening things up look like. I would say from everything that I know, and I think everything that medical officers of health have been saying, and including the premier, that this is not going to be a normal situation. It's not going to go back to the way it was 3 or 4 months ago. As long as this virus exists, there is going to be restrictions of some sort. Now, we may be able to relax some things based on the good advice of the medical officers of health and the indicators in terms of are we reducing the number of cases, and are we able to manage the cases that are happening. But if we if we land on all of that too soon or too quickly, we could very well be right back into a full closure again. So I think there's going to have to be very careful, thoughtful approach to this. And as I said today earlier, I think if as a start, depending on when that start begins, and we don't have a clear path on that yet, I would imagine the public spaces would be the easier targets to start with, and then we'll go from there. But will have to be a very managed, controlled, and a different kind of normal that we're certainly not used to for quite some time. Paul, any thoughts?
So I mean, I agree with everything that's going on in terms of the conversation so far, and what we do see from all of these jurisdictions, and it's been great to work with Elizabeth's team to see that, is that we will have to be open to the fact that even when we do start a service up or something happens that we reopen something, it's not reopened in the way necessarily that we knew a few months ago. And so I think the two elements are A, what will start to be opened up, and then B, within that context, how will we operate and how will the public interact with some of those services? And at the EOC, that's one of our going to be one of our major challenges as we hear federally, provincially, and locally what it is that's going to happen and when. We then need to translate that into operationally. What does that mean for both the women and men that deliver services for the city of Hamilton, but also for those that interact with those services? And I think that's the piece that we're getting our heads around. And Mr. Mayor, you've talked about it, is that coming out of this is not just coming out of it to the same as it was. It's coming out of it to something different, but it will be a little less restrictive, certainly, than we see today.
And if I could
Can I just add,
just,
I was on a webinar yesterday with Bloomberg, who's bringing mayors from across North America together. It was a broad conversation about where all the different municipalities across North America are at, and they're all different. And so there's no cookie cutter to this. It's really specific circumstances in specific communities, and how that then translates into what we can do. I can tell you the comforting part of the conversation yesterday. It included the Senate Majority Leader Nancy Pelosi giving us a kind of a broader American response view, as well as Bloomberg and other professionals through Johns Hopkins and Harvard. Was that this is a difficult circumstance for every part of every municipality in not North America, but in the world. And so when we say we're all in this together, that's literally true, but we're all in it in varying degrees. And so when we look at how we're going to come out of this, it's very specific to our community. So when the province makes a declaration in terms of how we might relax things, that relaxing might be different in Hamilton than it is in St. Catharines based on where we're at. And so I think we need to be very mindful of that because we could be looking to other communities in the United States that are maybe a little bit more advanced that haven't had as many cases, and their businesses are starting to open up and it's being somewhat successful. We can't necessarily take that as the indicator for Hamilton because we may be in a totally different circumstance.
And if I could, I was just going to underscore some of the points as well around the length of time we'll be doing, something else rather than just returning to normal. So it really is looking at a new way of, opening businesses back up, being innovative, doing those sorts of things in a way. We're going to have to continue to rely on the foundational pieces in terms of infection control, people washing their hands, perhaps the use of masks in an ongoing way, the contact tracing and case management that we do, visitors returning to hospitals and long-term care homes where things are um, are people are most susceptible. How can we do things differently as we go forward? And so I think one of the things I know about Hamilton in terms of how we work is just how innovative it can be. And so as we look at what the next 18 months to 24 months look like, really needing to harness that creativity and look at ways that we can do things that will support all of our citizens to be prosperous and to still respect the fact that we're going to live with this virus for a while yet to come.
Thanks, Dr. Richardson. Dawn, did you have a follow-up question?
No, that was pretty thorough. Thank you.
Okay, great. Thank you. Next up is Samantha Craigs from CBC. Samantha, you can go ahead.
Hi, thanks for taking my questions. Dr. Richardson, we have heard from a couple of people who have been confirmed COVID-19 cases, and at the end of a couple of weeks, they're feeling good, and public health just sort of says, great, on you go, and they're not tested again before they're declared recovered. So I wanted to know what our criteria is for declaring someone recovered. Are they tested again? Are they tested twice? Like how do we determine if someone has recovered?
So there's specific criteria for clearance, we call it, that are out there. So that this is again used consistently across the province. Like all of our guidance, we're trying to make sure we're all using the best evidence that we can and doing it consistently. And so we do use a slightly different approach for those who are working in healthcare settings and those that are working in the community that are community based and not in those settings. So, but even in both of those, we do use non-test based criteria. The challenge with the test is it's a wonderful test. It's very sensitive, as we call it. It picks up things very easily, but it can continue to pick up the virus after it's no longer relevant in terms of the spread. And so that's the nature of this current test that we have. And so we need to use criteria that are sometimes test-based and sometimes based on just how well that individual is, how long it's been since they're infected, uses the best information that we have around what we know about the virus today. So with those that are in the community, yes, we go through a period of time. They need to have been at least 14 days since they were diagnosed, and they need to have their symptoms need to have significantly resolved, if not resolved fully. We all have had the experience that after we've had a bad cold, we may have a cough that goes on for a couple more weeks thereafter. So if it's really, some of those niggling things that we know are just post-viral, they're not an indication that the virus is still active and able to be spread, then we're able to release them from their self-isolation and let them go back to being about their business. So we use a similar process for those in healthcare as well, with just slightly different criteria. So there's not a need to test for those who are out in the community.
Okay. My second question was, we've all been looking at the numbers. Some days we have, 2 or 3 new cases. Some days we have a little bit more. You've talked in terms of how long it takes cases to double and that sort of thing. You've been good at sort of quantifying for us what our case rate is doing. I was wondering if you could do that again. Talk about, are our cases starting to spread out? Like what kind of shape are we in?
So we did have a good day yesterday with no new cases whatsoever, which, we thought perhaps might be because we've been so proactive in doing the testing. We were gathering up a lot at once and then, having a time before we did the next batch of testing. And that might well be the case, although we know we still do have community spread out there in the community that's going on. So today we've sort of been sitting somewhere around Sorry, that's my hand on my laptop. We did have new cases. We have about 10 to 15 new cases a day, sometimes less than that. Our doubling time is sitting out at a month, 31 days. And so that is really, really good news. So we think we're, as we've heard from the province, we think we're sitting in that, you know, peak, post-peak sort of period overall in terms of where things are at. That's not the case, unfortunately, for our long-term care homes, our retirement homes, where they're continuing to see outbreaks. And as I told you today, we've had some 4 more that have been called in today that we've been investigating. And so that's probably going to continue to be where our main focus lies for the next little while, is on making sure we protect the health of those who are in long-term care and in retirement homes and other congregate settings. You know, this is part of the reason why we do begin to look at what might come next, as we've been talking about already today. As we seem to be in that flat part of the curve.
Thanks, Dr. Richardson. Last question today goes to Joey Coleman. Joey, you can go ahead.
To the Mayor, Mr. Johnson, when do you expect the city's financial ledgers up to March 31st to be publicly available and posted? And what is the timeline for posting of minutes of decision making by the Emergency Operations Center?
Paul, did you want to take the EOC part?
So the EOC minutes are not posted publicly. As you know, Joey, we're on, I forget what meeting we're up to, but we're 44 days into this. So we announce our decisions as an EOC on a daily basis for a while. Now we're up back to 3 times a week. In terms of the financial piece, from a staffing perspective, I don't know. I'll have to check with finance around that, unless the mayor has a piece to add to that as well.
No, thanks, Joey. I think the anticipation is that we had an estimate in terms of actual financials or projected financials. I think the actuals will come out sometime after that period, and then there'll be another projection for the period 3 months hence. So the initial projection was $23 million, minimum $23 million shortfall, and that was projected to the end of May. And then as we go forward, we'll do another 3-month projection. With the projections that we sent to the federal government, we're based on a 6-month basis, and all the municipalities that participated sent their 6-month projections in. Just obviously projections based on the current numbers that we're expending and the revenues that we're not collecting as of now. So the actuals will be sometime after that May period.
No follow-up.
Thank you. Mr. Mayor, we'll pass it back to you for closing remarks then.
Great, thank you very much, and thank you to the media for continuing to share information in the broader community. It's key for us all to share as much information and much understanding as we can to everyone out there. So much appreciated, and thanks for tuning in CHML to continue to broadcast that on an ongoing basis, as well as Cable 14 and our live stream. I can say to the community at large, we're not out of the woods yet, but there's things are looking better. So obviously, clearly, we're going to get through this together. There's a lot of support coming from our federal provincial partners, as we would expect they would, and more coming. And so we need to keep doing what we're doing. It's been successful. It's working. I think we've, in many respects, seen some flattening of the curve. That doesn't mean it stays that way, but certainly the indicators are particularly good for Hamilton right now. So that's all a testament to your good effort of staying the course on staying home as much as possible, washing your hands, coughing into your elbow, maintaining that 6-foot separation wherever you are, and still managing to get out to enjoy the improving weather. And we fully understand and appreciate that the nicer weather is going to get everyone more antsy. We're all feeling that as well. Certainly I am. And hopefully with a flattening of the curve and a reduction in cases, we can start to look at how do we start to open things up so that people can get out a little bit more liberally than we are right now. So thank you for all the good work that you're doing. It really is work that you need to do to help support all the frontline workers out there that are looking after those that get sick or need hospital care. But avoiding the spread of this virus is still critical, and everything that you're doing now helps make that happen. So thank you, and continue doing that. And I hope you all have a wonderful weekend. And we'll see you on Monday for any further updates that we can provide. Thank you. Have a great weekend.